Hello, and welcome back to this training program for researching the cost of INTS treatment in government health facilities. In this section, we'll review the study protocol for the research. Study protocols usually consist of the purpose, the perspective, the focus, the approach, and the methodology. The purpose of INTS cost of treatment research is to determine the cost of treatment of INTS by government-funded health facilities. This is going to provide a basis for comparing the cost of preventing INTS versus treating INTS within the population served by the government health facilities. We're conducting this study so that government program managers and policymakers can make informed decisions on INTS treatment and the introduction of typhoid conjugate vaccines. Used together with the typhoid conjugate vaccine costing tool we've developed, we can compare the cost of preventive intervention versus treatment intervention versus a combination of the two. In this study, we're looking at costs from the point of view of the government. Other studies will look at the cost of INTS to the patient and to the family, but we're not concerned with that in this particular study. We're also not concerned with the private sector costs or the costs of the research study itself. Cost of illness studies can be conducted from one of three perspectives: a retrospective costing, a prospective costing, or a cost projection. In a retrospective approach, all the relevant events have already happened when the study starts. We can therefore just collect the data from records or from interviews. In a prospective approach, the relevant events have not yet occurred at the beginning of the study, which means that we would need to observe and collect the data as it happens over time. This can take a significant amount of time and effort. In a cost projection approach, though, we can take the data we know from retrospect and apply it to the future. By changing certain variables, we can see what effect that might have on the outcomes and the cost. So our projection, although it's an educated guess of events that might occur, it's not actual observation of these events as they occur. This study uses the ingredients approach to costing. In this approach, we break down the cost of resources used for each procedure into measurable units, such as personnel minutes spent or milligrams of drugs given. We then collect the information on how much of each resource was spent on average to complete each different type of procedure for each different type of case. Well, this approach is more time consuming and it's quite detailed, but it yields more accurate and reliable data. We also are using an incremental costing method. In this method, we only include resources used for specified procedures. We do not consider procedures or activities that are already being done without regard to the specific procedures of interest to us. We focus in this study on 12 different case types that we've divided into 4 groups. We're costing cases involving adults separately from cases involving children under the age of 3 years. Also, we're differentiating between the cases confirmed by blood test and cases where no blood test was used to confirm a case. We are separating antimicrobial resistant cases from antimicrobial sensitive cases. And finally, we're separating outpatient cases from inpatient cases, and within the inpatient cases, the non-surgical from the surgical cases. In this way, you can see we have a broad matrix of different case types to which we will be applying procedures, treatment procedures. We have 10 treatment procedures that we are going to be costing. The first and second have to do with the intake or diagnosis of the patient, one being outpatient and the second being inpatient intake. We are then looking at 4 different possible dosages of antimicrobials. Those are first line versus second line antimicrobials, and those are doses given to adults versus doses given to children. We are also looking at inpatient procedures. One of them would be resuscitative care for non-surgical problems, and the last 3 would be surgery for major complications, together with surgery preparation, which requires inpatient intensive care, and post-operative care, which is also inpatient intensive care. So we'll be looking at these 10 possible procedures applied to the 12 possible case types. We're going to be doing a detailed costing, and we have divided the cost into 4 different categories. Those are personnel, drugs and medical supplies, other supplies and materials, and other direct costs. To begin with, based on our interviews, our review of standard operating procedures, and other records, we create a list of ingredients and their measurable unit costs or prices. For example, we may list the average monthly salary and benefits of a general practitioner and find that this type of personnel works approximately 10,560 minutes per month. That's about 22 days times 8 hours per day times 60 minutes per hour. We can change that here according to what our country norms are. We can also, that way, assign this cadre a unit cost per minute. And the costing tool will calculate that for us, and then that can be used in the different calculations that we make for the procedures that that general practitioner is involved with. We can also document the unit price of drugs and other supplies in a similar way by looking at the package in which something comes in, and then the number of tablets or capsules or milliliters that comes in, that is the specifying unit for the number of units needed for a procedure. That way we can get unit costs for drugs and medical supplies, and we can apply those to the procedures that we are costing. In the detailed costing method, then, we will be presented with a series of pages that we have to fill out, in which we tell the tool what type of people and what types of other resources are used to complete a treatment procedure. So here you will see the personnel list, where we can select from drop-down lists the type of personnel who is involved in the procedure. We can write in the task performed, and we can write in the number of minutes spent, and any other notes or sources of information that we think will be useful as we review this. Similarly, we can, from the drop-down list, choose drugs and medical supplies that are used for this treatment. And these drop-down lists are being developed from the ingredients price lists that we've already completed. We can then look at any other supplies that are used by putting in the drop-down list, the number of units spent, and making a note about the purpose of the use of the supply, similarly for other direct costs. Once we've completed that, the tool will automatically calculate the total cost estimate for each procedure in the financial and economic costs, as well as local currency and US dollars. So when we get the ingredients unit prices, and then we multiply them times the number of used for a procedure, we can get the cost per procedure. Then, based on the cost per procedure, we can multiply it by the number of procedures that were performed to get the total cost of the treatment procedures in general. We also are going to need to know what kind of equipment was used for the procedures. As part of our calculations, we also include costs of equipment required to perform the procedures being costed. We include specialized equipment that could be found in the outpatient department or in the inpatient setting. We also include laboratory equipment, radiology equipment, and surgical equipment as it's needed. We know that much of the equipment is shared with other procedures, so we try to estimate the proportion of time that each equipment piece is used for INTS-related procedures. For the calculations, we're going to be saying the equipment type cost times the number of equipment units in a set equals the cost per equipment type in set. And the sum of equipment type cost per set equals the equipment set costs. When the automatic calculations are done, we will have put in the quantity that are required of each type of equipment, and also the estimated proportion of time that it's used for INTS-related procedures. And in that way, we will get an idea of the initial investment cost for this equipment, proportional to the amount of time we think it's being used for INTS. So that's the study protocol for the INTS cost of illness research. When we understand the purpose, perspective, focus, approach, and methodology used a little better, we should be able to collect and input the right data to get a useful cost analysis. Thank you for your attention to this section, and let's move on.